Diabetes is the fastest growing chronic disease in Australia and arguably the greatest health challenge that the country has ever faced. Approximately 1.7 million Australians have diabetes and an estimated 280 Australians are diagnosed every day. By 2017, diabetes is expected to overtake coronary heart disease as the leading cause of disease burden in Australia. The Australian Centre for Behavioural Research in Diabetes is the first research centre in Australia and internationally to place a strong national focus on the behavioural, psychological and social aspects of diabetes. Led by Foundation Director Professor Jane Spate, the Centre provides national leadership to inform policy and to advocate to reduce the impact of diabetes.
The way people think and feel about their diabetes affects the way they manage the condition. The Centre brings a national focus to these issues to inform policy, services and treatments for people with diabetes.
The Centre was established in 2010 as a partnership for better health between Diabetes Australia Vic and Deakin University.
The partnership that we have struck with Deakin University from 2010 in establishing the Australian Centre for Behavioural Research in Diabetes is a great example of focusing on an area of unmet need, to understand more about what it means to be diagnosed with diabetes, how people cope, and how we can do research into this area to improve the lives of people who are diagnosed with either type 1, type 2 or gestational diabetes.
We're absolutely delighted to be able to partner with Diabetes Australia Victoria in the Australian Centre for Behavioural Research in Diabetes to address a real problem which has significant consequences for a large segment of the Australian population.
The Centre's collaborations extend beyond the initial partnership between Diabetes Australia Vic and Deakin University.
We collaborate with many clinicians and researchers in Melbourne, across Australia and internationally. Our work is funded by the Diabetes Australia Research Trust, the National Diabetes Services Scheme, Vision 2020 and the NHMRC.
The staff and students at the Centre are working on a diverse range of projects, all of which seek to reduce the impact of diabetes for people affected by the condition. Dr. Jessica Brown is a research fellow who is leading some of these important projects.
We've done some research that sought to understand and address the social stigma in diabetes. We interviewed many people with type 1 or type 2 diabetes to explore their perceptions and experience of diabetes-related stigma in their daily lives. And our studies were the first to explore this potentially destructive social phenomenon in a systematic and in-depth way. One of our key studies to date has been the Diabetes Miles study, which was a national survey of people with diabetes which focused on the psychological, social and behavioural aspects of living with the condition. And this survey was one of the first of its kind in Australia. The results have provided an invaluable snapshot into the emotional challenges that people with diabetes face, as well as invaluable insights into issues such as healthcare access, support and self-management patterns.
As well as taking a leading role in national research, the Centre is also a national resource for other researchers and health professionals working in diabetes. Dr. Christel Hendricks, clinical psychologist and research fellow at the Centre, is driving some of this significant work.
More and more healthcare professionals acknowledge the need to provide psychosocial support to people living with diabetes. However, it's not yet part of routine care. And one of the main reasons is that healthcare professionals often don't feel skilled to talk to their patients about their emotions, feelings and difficulties of living with diabetes. And therefore psychosocial problems are often overlooked. Now, our centre is organizing workshops for healthcare professionals, and also we are currently writing a handbook on mental health of people living with diabetes. These resources for healthcare professionals will help them to improve their consultation skills and strengthen their confidence in talking about psychosocial problems.
The Centre is also a training ground for the next generation of researchers, attracting PhD students who are developing innovative research projects which aim to tackle some of the challenges associated with living with diabetes.
I've been working and studying at the Centre for 3 years. I began as a full-time research assistant and was lucky enough to work on a broad range of topics. I've since begun my PhD through Deakin University.
I'm currently working on a review that's focusing on fear appeals in diabetes media campaigns.
I'm working on 2 national projects looking at youth transition. This is an important area because a lot of children, as they move from paediatric care into adult services, a lot of them forget to keep attending their regular appointments, and this can cause complications later on.
I'm currently working on a project funded by the National Diabetes Service Scheme, which is developing resources for health professionals to help them identify psychological problems in people with diabetes.
I'm working on a Diabetes Miles Youth Survey. The survey is concerned with trying to understand the psychology of young people with diabetes and their parents.
With all types of diabetes on the rise, the work of the Centre is crucial to furthering our understanding of how to meet the psychosocial needs of all people affected by diabetes and to inform the future provision of support and services for people with diabetes.